Good afternoon and welcome to Raajje TV. I'm Hussein Makhtoum with today's First Call program. On today's program, we'll be talking about MIOT Rehab Centre open today in Maldives City, and we'll be giving details about the Rehab Centre and the MIOT International India. In today's program, with me, Dr. Prithvi Mohandas, Managing Director of MIOT International India, is participating. Welcome to Maldives and welcome to Raajje TV as well.
Thank you very much.
Today we'll be talking about the Rehab Centre open today in Mali and about the services and also about the MIOT International. So before going to the detailed questions, could you give me a brief introduction about MIOT International?
Sure. MIOT Hospitals in Chennai is around 26 years old, and for the last 10 years we've had a very close relationship with Maldives, both with the government of Maldives via the Ministry of Health, with a lot of the health professionals here in Maldives, various doctors, nurses who've come to our organization for various programs, both for short-term and medium-term exchange programs. And also we've run certain specific services when required at IGMH from time to time, whether it's anesthetic services, neurosurgery services, or gastroenterology services. So obviously some patients who can't be treated in Maldives for certain specific illnesses do travel to Chennai for treatment via the Asanda scheme.
So in the past decades, the Indian Maldives and also MIOT International and as you have mentioned the IGMH, also with the governments of Maldives, there's been a long-term relationship. So how do you describe the relationship between the MIOT International India and Maldives, and how has it evolved in the past decades?
Well, I think there's a lot of trust that has developed over the past 10 years. Now we are no longer looking purely at patients who need treatment outside. We're trying to see if it's possible in many cases, and hopefully soon in all cases, that patients don't have to leave Maldives for any reason regarding healthcare. That's the goal. And now over the last year or so, we've been trying to work towards this seriously, and we're now making our first step with the MIOT Rehabilitation Centre here in Mali.
Okay. So there are already rehab centers in Maldives run by the government from a national drug agency, and they have been providing services as well. So I was thinking, why MIOT International India decided to open a rehab center in Mali itself, even though there are some rehab centers already open. So why?
So I think that rehabilitation has been grossly misunderstood in many developing countries, including my own country. When we opened the rehab center in Chennai at MIOT 3 years ago, there was the same dialogue in India saying that, oh, there's a lot of this already, why do you need to open it? To be very upfront with you, there was only one genuine rehab center in the whole country which existed in New Delhi, the Indian Spinal Injury Center, and everybody who had a complex problem had to go there. The rest were merely physiotherapy units with physiotherapy. Now, physiotherapy is a completely different ball game when compared to rehab. A rehab is a comprehensive process. It's a process that gets an individual to the destination that they want to go. It's a process of getting an individual completely independent, and it addresses a huge spectrum from children to older people and various different kinds of acquired, congenital, and traumatic diseases, which really cannot be handled by a physiotherapist. So today, the rehab center at MIOT is the only one in South India, and it is absolutely chock-a-block. There's no room to even stand there. It's so crowded, it's so oversubscribed. And when we look at this country, Maldives, and we look at all the sophisticated treatment that goes on in your country, it's clear that similar to our country, rehab would permit patients to really get the outcome that they're looking for and reduce the necessity of these patients from traveling overseas for treatment.
So Rehab Center, MIOT Rehab Center, so how did it all started, and how far have you guys been traveling? Is it only just in India or in Maldives, or where else are you located?
So when you look at MIOT hospitals, the goal of MIOT hospitals is to try to provide care in countries which need specific kinds of care so that it prevents or reduces the dependence on overseas medical treatment. For example, we're very strong in the Pacific. We provide open heart surgery in Fiji. So any person living in Fiji who needs heart surgery has treatment by us in Fiji, end to end. Rehab center is coming up in Mauritius. We have a huge day surgery unit in Seychelles, which is a 4-story building. We have cath lab services in Uzbekistan. We have full-fledged operating theater performing surgery in Tajikistan. So a lot of geographies that we're already present. When you look at our own journey in rehab, patients come to you with complex disease, difficult to treat disease, multiple problems, and they want cure. They don't just think a procedure done on them is cure. So there are patients with complex sports injuries, patients who need spinal treatment, patients who've had accidents and therefore they're unable to walk because of spinal cord injuries, or patients who've had spinal cord surgery and are unable to get back all the recovery that they wanted. We find that it cannot happen without rehab, and rehab is an actual area of medicine now. You have a degree which makes you a specialist in rehab medicine. You have a rehab board with around a dozen people sitting on the rehab board. These are psychologists, these are speech and language therapists, occupational therapists, neurologists, neurosurgeons, etc. They are assessing how to get you back to your job, get you back to your full independence, and get you back to the kind of activity you wanted to do before you started your quote-unquote treatment. And a lot of the time with this rehab program, which is different for different people, some people it may be 3 weeks, some people it may be 3 months, you will get to your destination through this program.
When we talk about the rehab centers, mostly people picture it as a drug rehabilitation center. And as I mentioned before, there are many rehab centers, also hospitals and health centers providing rehabilitation services, and private hospitals are also there in Maldives.
Sure.
They have been providing services for different patients in different conditions for different diagnoses.
Absolutely.
So what inspired the launch of MIOT Rehab Centre in the Maldives, and what are the services? I think patients or the people who are watching the program would want to know what are the services provided by the MIOT Rehab Centre in Mali.
The simplest example to portray the success of rehabilitation is the dramatic improvement and return to independence of stroke patients. So back home in India, we have stroke patients. They have access to coiling of aneurysms. They have access to stenting of blockages in their brain, removal of clots via pinhole surgery. None of them get back to independence without rehab. And that's one of the easiest things, what you call low-hanging fruit. There's definitely neurological disease here. There is incidence of stroke here. There is the offering of thrombolysis for stroke in Maldives. And these patients will be disabled without rehab and will not be able to get back to total independence without rehab. So rehab includes a whole variety of devices that need to be used, structured programs depending on what is wrong with the patient, whether it is swallow, whether it is speech, whether it is cognition, whether it is mobility, and focusing on what outcome you want for the patient. Is the patient going back to a particular kind of job? What does that job entail? Is the patient a carer at home? What does that entail? Does the patient require to be completely independent? So are you working on their balance? Are you working on muscle power? Are you working on nerve recovery? And there are specialists in allied health for each of these. So without a comprehensive team, without a structure in place, without a proper rehab plan, and without the right equipment, you cannot achieve the patient's goal. Further, this particular center in Mali is approved by Asanda. The cost is extremely reasonable. All the costs have been discussed and confirmed with Asanda, so it will also be accessible for the people of Maldives.
So there are a lot of services which will be provided by the MIOT Rehab Centre open today in Mali. Would you say it is the first of its kind in the Maldives? As I have mentioned before, there are
Of course.
rehab centers and patients are getting treatments from hospitals as well.
Absolutely.
So, would you say this is the first of its kind in Malay or Maldives?
Yes, I think that when you look at the results that can be achieved by this comprehensive protocol, and we are talking about both children and adults, we are talking about conditions which you're born with, like cerebral palsy, or conditions which happen when you're a child, like autism, also diseases which happen as you grow older, like Parkinson's, apart from the conditions we've already discussed, like injuries, stroke, etc. For recovery to happen, you need a specific program with a specific team. And when we've looked back at the results we've achieved in our rehab center, we are simply making a carbon copy of the same center with the similar personnel here in Maldives, also with very, very new age telemedicine services, where if we need to get the advice or expertise of particular super specialists, we can instantly do that with discussion with the patient sitting there from a specialist at MIOT Chennai. And this will make it even more comprehensive without having to leave Maldives and travel to Chennai.
There are a lot of Maldivians who travel to Chennai for medical treatments, and for that government is spending in millions for that by Asanda. So you have opened a rehab center in Maldives, and you are providing many services which local patients are getting from Chennai. Also, MIOT International is one of the hospitals people go for the treatment. So what are the type of patients who will be benefited from this?
So, as you're well aware, if you're satisfied with services in your country, you won't go overseas. So our focus is to try to get Maldivians to be satisfied with the services provided here. So there's a lot of shoulder treatments happening here. There's a lot of orthopedic treatments happening here, spine treatments happening here, etc. And still Maldivians for the same problems are going overseas. And the reason for that is they feel that if they have treatment here, they may not get the same result. The reason that they have that feeling is because they don't have structured rehab. We ourselves have treated patients with multiple complex, repeated sports medicine problems who come back to Maldives and don't achieve their result because of the absence of real rehab. And it is for that reason, apart from the other reasons we've discussed, that this center will reduce the number of people going overseas grossly by giving them the same result in Maldives, because once they have treatment here with specialists here and see that they get the same result after rehab as patients who go to Chennai, they'll be happy to not leave Maldives at all for certain specific cases. Once trust is built and patients realize that for certain reasons they don't have to go overseas, slowly we'll ramp up the offering to other offerings, so that slowly in future our goal is to completely stop patients from having to leave Maldives.
Why is continuous care beyond hospital treatment is essential, and why would you recommend MIOT Rehab Centre in Malay for the treatments and the services?
In the past, we were not treating complex disease. In the past, if a patient had a complicated condition, they lived with it. In the past, if a patient felt that the treatment they had, whether it was a surgery or a device put inside their body, didn't give them 100% result, they lived with it. Today, people want quality of life. Today, people want to be independent. Today, diseases we previously thought we can't cure, we are attempting to cure. Real cure does not just mean doing a procedure. Real treatment means giving the person who wants the treatment the result that they want. You can't achieve that without rehab, and you can't achieve that without structured rehab. And that is what this center will do for all the Maldivians who access it.
So have you already started the services, or is there a date which will be starting?
They open on Saturday.
On Saturdays.
Yeah.
So far, how is the queue? How's the line of the patients who are coming?
So as you're well aware, there are patients every month that are coming to India for treatment, and they're all aware that this center is opening on Saturday. We can't book appointments or start the business until Saturday, but all our old patients from Maldives who are part of the MIOT family are well aware that the center is going to open on Saturday. They're very excited about it. This is a relatively small country. Most people know each other. So of course there will be a lot of interest generated, and as you say, we will have to handle this interest and make sure that everybody is satisfied by organizing their appointments from Saturday onwards.
Yeah. People are going abroad for different purposes.
Yeah.
Some are going for the surgery, some are going for treatments, and some are going to consult doctors for long-term diseases because they haven't got a good cure for that.
Yeah.
So from the MIOT Rehab Centre in Male, so what are the services? Are they going to get the same treatment as MIOT International in India, or there will be a difference in that? And how are you going to cope with the patients while treating of the treatments?
So rehabilitation from A to Z, for example, whether it is respiratory rehab because of similar viral illnesses like COVID, whether it is cardiac rehab, etc., will be the same standard as it is at MIOT in Chennai. It's the same protocol, same skill set that we have chosen. We have been able to hire local Maldivians with very, very good qualifications and skill set, and where we are not able to, those are the only instances where we have people who are coming from Chennai. We've also taken some staff back home to Chennai to train to staff here. So the level of expertise and the result will be as good, if not better, than having this in Chennai. The concept of rehab in all developing countries is grossly underestimated. There's no focus on really achieving a great center for rehab simply because developing countries focus mainly on gadgets and on diagnostics. So they say, hey, I have this to make sure you have or don't have cancer. I have this to treat heart disease. But there's virtually no investment in rehabilitation. Over the last 3 years, with more than 3,000 incredibly success stories, we have seen with our own eyes in real time the huge success of rehab in patient satisfaction. So the only way you will reduce patients from going overseas is by giving them satisfaction. So once you start giving a lot of patients who've had some treatment in Maldives satisfaction, you'll reduce the numbers going overseas.
I have some more questions for you about the rehab center, about the MIOT International India, and your team.
Yes.
So before going to that questions, I have to take a little break for that. So we'll come back with more questions after Asr prayer. Welcome back to the first half program. Today we are talking about the MIOT Rehab Centre, which was opened today in Male, Maldives. And with me, Dr. Prithvi Mohandas, Managing Director of MIOT International India, is participating, so he could elaborate more about the rehab centre and the services provided by the rehab centre. So we are talking about the patient care, about the treatments which will be provided by the MIOT Rehab Centre in Male. I think most of the patients would be asking one question. So do we get asanda? I think that is an important question to highlight. Do we have to apply for the asanda? Will it work as same as MIOT International India in Chennai hospital? Also, the same process will be there, or how do we have to do it? Or already you guys have been talking with the government about providing asanda to patients. So how is it going?
That's a very important question. Obviously, as you're aware, we have strongly advocated for a long time during our relationship with Asanda that if a patient has a surgery or a procedure a lot of the time they will need a rehab so that that particular treatment is 100% successful and satisfactory for the patient. And when we told Asanda, we see patients who have shoulder surgery, knee surgery, hip surgery, spine surgery, and these patients can have rehab in Maldives if we open the rehab center. Asanda was very excited about it. In October, when we got permission to go ahead with the rehab center, obviously apart from planning the actual inside and the equipment, we also started discussions with Asanda. We listed all our different rehab treatments that we can offer, from stroke to orthopedic to neuro, etc. We also agreed on the pricing with Asanda. So basically, a patient will be referred to us from Asanda first for consultation regarding rehab. So it could be any spectrum of the disease. It could be a child or an adult or a very elderly person. And usually the person will come, obviously maybe with a family member, have a consult with us, which will be definitely supported by Asanda. And after that, we'll raise a treatment plan with pricing to Asanda, which they'll approve, and then the patient can go ahead with the treatment.
I think that would be an exciting news for the patients who are already with MIOT International.
Sure.
I think, including me, we want to know that about your team.
Yeah.
Who are there, who will be working, who are the specialists or the doctors?
Absolutely.
What kind of a team would be working in Male,
Right.
and about the services and everything. So could you tell me about your team?
Yes. So yes, it's a combination of very, very exciting technology and an excellent skill set. So firstly, for you to get a rehab program, you will consult an expert in rehabilitation medicine. Rehabilitation medicine is a specialty on its own. You need a degree, and the rehabilitation doctor who is a specialist will commandeer others as required depending on the sort of rehab you need, and then come up with a rehab program. This program will be executed by people with a various skill sets. So you will have an occupational therapist. So if there's a particular job that you need to get back to doing, they will explore what all you need physically to be able to do to make sure you execute that job correctly and achieve that. You will have a speech therapist if required. So say you're a person with a stroke or a person who's had cancer treatment and you have a problem with talking because of that, then they will work on your speech. There's also an area where people have difficulty feeding, again because of certain problems. Maybe it's a neurological disorder, a brain disorder, a nerve disorder, or a treatment that you've had that's affected your ability to swallow food safely without what we call in medicine aspiration. So there'll be a swallow therapist, language therapist, speech therapist. You also have specific people for specific goals. So there are people who fall frequently because they have a problem with balance. There are people who have certain kinds of nerve weakness. They may need machines that help them with their balance, machines with virtual reality to help them overcome the weakness. There will be an element of psychotherapy that's required. Certain people with nerve disorders may need nerve conduction studies. So there are around a dozen different specialists with different skill sets who all come under the umbrella of allied health to make sure that the program is executed.
So you were talking about the personalized treatment plans for the patient. So how do you make a personalized treatment plan for the patient? And also, what about the equipments and technologies that will be available at the center in Male?
Right. So all employees of MIOT, ever since we started 26 years ago, are full-time. So today we have around 3,000 employees, and we have an institution called the Rehab Board that meets 3 times a week to design these tailor-made programs for patients. Apart from that, there are some amazing pieces of equipment that revolutionize patient care. One of the challenges that we have is dealing with patients who have been bedridden for a long time. A patient who has to be rehabilitated, if they've been lying down for a long time, it's extremely difficult for the body to tolerate a sitting down position or a standing position. So there's this remarkable piece of equipment that is called a tilt table that will rehabilitate you from your lying down posture, which you've been doing day in and day out, maybe sometimes for years, and get you both to sitting and standing safely and make sure that you achieve a certain degree of independence. The other area which is exciting is the patient who's paralyzed. The patient may be paralyzed from the waist down, and you need to get them rehabilitated to walk. First, you need to get the fear of falling out of them. So these patients have use a special device with a harness that eliminates gravity for the patient. So the patient is suspended, the patient's lower limbs are exercised, the patient has what is called virtual walking with a motorized device, and then progresses to real walking on the ground. So these are two of the exciting technological bits that help with the rehab.
Yeah. So how does the center ensure accessibility and convenience for patients with mobility?
So there's a wide spectrum of patients that will come to us, from children to elderly patients. First of all, the elevator is designed so that disabled patient in the disabled means of transport can safely sit in the elevator. And also we have special areas within the rehab center for these patients. Most importantly, of course, is toilet access. We have a very, very well-designed disabled toilet for disabled patients to use safely within the rehab center.
Over the past decades, there are thousands of patients from Maldives have been to Chennai, to MIOT International for treatments. And today you have opened a rehab center here in Maldives, and people are eagerly waiting for the services. So from the rehab center, so you'll be doing full-time works or just for the rehab works? Also, do you have any future plans maybe to open a clinic and give more services here in Maldives rather than patients going abroad for the treatment? And I think it would be also cost effective for the patients who will be traveling to India, Chennai, for the treatment. So what are your future plans here in Maldives?
No, you're absolutely right. We're very keen to step up our services here in Maldives, but you have to start somewhere, and you have to start by building trust that you're capable of executing what you're saying. You're making real difference by the service that you start with, and that's why we felt that this is an area which will help us build trust with the local medical community, with the government as well, to show that we're not here to make a quick buck. We're not here because we're trying to see that it's a good business plan. We're actually trying to make a difference. And I think maybe in 9 months' time, when it's clear that this is a success story, then we will obviously have discussions to see what else we can do, which other areas that we should address to reduce the dependence on patients having to travel overseas. And depending on the need and depending on the possibility, we will choose particular areas and add as we go forward, definitely.
So, you were talking about telemedicine earlier. So how does MIOT's next-gen telemedicine enhance patient care, especially in enabling real-time consultation with specialists from MIOT International in India?
So it's interesting how telemedicine has evolved from just being a video call to the current telemedicine kiosk, where you can plug in devices and have, as you say, a real-time consult. You can plug in the ultrasound machine, the echo machine. You can have examinations of the status of a patient's ability to swallow and speak. You can have examinations of certain dermatological skin conditions of the patient in live time. And you can give ECG recordings of the heart as well in live time for you when you're having a consultation. So we have 63 different specialties back home in MIOT Chennai. We have a timetable for specialists to perform telemedicine, and I think that with the advent of this sort of technology, the telemedicine consult will evolve into virtually a full-fledged all-around consultation as if you were sitting in Chennai while you're seated here in Maldives.
You have mentioned there are other rehab centers around the world.
Yes.
They are working and performing very well. So can you tell me a success story about the rehab centers all over the world?
Definitely. I think it's a combination of technology, it's a combination of understanding how the team is able to work, and then it's a question of familiarizing the patient with particular devices that they will use in their life's journey. So, the Rehab Center at MIOT has numerous success stories. The rehab centers that exist at the Mayo Clinic have incredible success stories. The Beruf Genosen Center in Tübingen, which basically treats patients who have become disabled because of accidents, have amazing success stories. These may be patients who come off a motorcycle with multiple injuries, have had operations, but still have not been able to go back to work. So there are a combination therapy case scenarios which make it very, very possible for people who thought that they may never become independent to now have hope.
So before concluding the program, would you like to highlight anything else other than we have talked about the rehab center in Maldives, also the treatments and the technologies, equipments and everything? Other than that, would you like to highlight anything?
No, I think that it is incredible for us to find that there is an amazing work ethic in Maldives. People work extremely hard here. When we look at our own colleagues in healthcare, in the government sector as well, they're very, very motivated. So going forward, really, our goal is to try to run centers like this and to expand in Maldives using mainly Maldivian workforce, because their commitment and their ability to work hard is something that we have great synergy with. So I think it's going to be an exciting journey for us.
Thank you so much for participating with me in the program. And on Saturday, the rehab center will be opened officially, and that patients can get treatment from the rehab center as well. And I hope you and your team have a great stay in Maldives. Thank you so much for.
Thank you. Thank you.
With this, I will conclude the program. I hope I have given enough information about the MIOT Rehab Center, which was open today in Male, and about the services, also about the MIOT International India. Thank you so much for your time. Have a blessed day. Bye-bye.